Doreen 𝗏𝗏𝗧 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗧.
Dr. 𝗏𝗏𝗧.
Dr. Doreen 𝗏𝗏𝗧.
Dr. Doreen 𝗏𝗏𝗧 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Our Journey Cameron's New Life wrote in and talked about that because their son is 7 now and very hyperlexic and has some anxiety around that. And I'm piecing it together, but that recently it sounds like they went into a store and the sensory of letters and numbers and words, he could barely move in the store. She says he won't wear his sunglasses, but she's talking about getting a stroller with a hood. And for a 7-year-old, I'm thinking maybe, because this is also a kiddo that what I know about him from the years that we've been talking is that he requires a lot of physical input and likes to jump on the trampoline, and that he's a little bit more centered after that. So I'm thinking putting him in a stroller with a hood, maybe not the thing.
Yeah. It depends. I mean, you know your son better than we do. I wouldn't want to stigmatize him as well, being in a stroller
7.
at that age.
Yeah.
But if that is the only way that you think he would be able to tolerate things, then that's the only way. Like, you modify the environment as much as you have to, preferably as little as you have to. Have you tried a hat with a visor? Have you tried those, do you remember those giant visors that came out early COVID, I think, where like they cover the whole face? I don't know if he would like something like that. And by the way, I know that he might not keep his sunglasses on initially, but that's a shaping procedure. So I promise you, I've had kids who have been severely affected by autism, and I've taught them how to keep their glasses and headphones on when they go out. So the way to do it is to start with a very, very minuscule period of time and a huge reinforcer. So you have something that the child desperately wants, like a edible food, right? Cookie, something. And you have the child put the sunglasses on for 10 seconds or whatever they can handle. And you say, yay, good job. And you give them the reinforcer. And then you gradually increase that period of time. And then over time, much time, a month, you reduce the reinforcer. But it is possible to shape. And also, like, once the child starts to put the thing on and feel more comfortable with stimuli, they actually prefer it themselves. Like, I had a child who was in New York City, and honestly, in the beginning, he would just throw anything we tried to put on his face. But gradually, he got to the point where he wanted his sunglasses when he went outside. Not only that, he wanted his headphones because the noise was so high for him. So, try those things out first. It works. It takes a longer time, but it works.
And I know, because Mom, you identify yourself as somebody who has sensory sensitivities to tags and things like that. So I know you're probably extra aware of him being uncomfortable. But I do want to point out that we had parent after parent during COVID who would write in and say, there is no way I'm ever going to get my child to wear a mask. And that each and every one of those parents who followed the protocol that you would lay out for them wrote back and said, I cannot believe that my child is now more comfortable wearing the mask. And then we've had to go through the procedure of getting them to not wear the mask anymore in public.
That's true. That's
right?
true.
So I just want to tell you that I think that it's infinitely doable, but you're maybe going to have to move slow. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.